we want to talk about pregnancy, blood pressure disorders. There's been a rise in these. U.S. recommending more frequent blood pressure monitoring, especially when you are pregnant. So Dr. Sean Donishman joining us here, maternal fetal medicine specialist at Scripps Clinic. Good morning, doctor. Thank you for being here.
Good morning, Netta. Thank you so much for having me.
You know, this one, I saw some of the latest research on this, and I'm like, oh, I'm one of these people. I have to monitor my blood pressure a lot during this pregnancy because...
Congratulations.
Thank you, thank you. I'm like 26 weeks in, but last time with my first child, I had preeclampsia. So let's talk about that. Blood pressure, pregnancy, what are you seeing in the Scripps Clinic?
Yeah, unfortunately, you know, hypertensive disorders in pregnancy or high blood pressure. You have patients who have pre-existing hypertension. You know, they have elevated blood pressures before typically 20 weeks of gestation. Okay. You have preeclampsia, which is elevation in the blood pressure as you had, and also spillage of protein in the urine. Typically, we don't spill large macromolecules in our urine, but in preeclampsia you do. And then you have something else called gestational hypertension, which is, again, elevated blood pressure after 20 weeks, and someone who's had normal blood pressures before that. And unfortunately, these disorders are on the rise. You know, we've had, you know, a double increase over the last 3 decades. There was a recent study that was just done nationally looking at 2 million pregnancies, and unfortunately, again, pregnancy-related complications and childbirth complications are on a rise in double digits, and a lot of that is, again, preeclampsia. Preeclampsia, Netta, is the leading cause of maternal death in black women. They're more likely to die, 3 times more likely to die than white women. And during pregnancy and postpartum.
It's so high? Is that
yeah,
what's
we don't
happening?
Yes, blood pressure goes up, and if it's undetected, and this is why the U.S. Preventive Services Task Force recommends routine screening, because they are a group of experts that are volunteering and basically looking at peer-reviewed journals and data and making recommendations to improve health inequities, to ultimately improve health outcomes. So therefore, we know that women are dying, and we can do something to improve it, so make sure that at least as healthcare providers, we know this, so we can implement new programs to be able to address this.
Now, as I've learned through just my first pregnancy, now this one, preeclampsia is something that's really hard to know how to prevent. But what would you suggest, someone who's watching right now, kind of maybe going through the same thing or wanting to get pregnant, how do we make sure we're as healthy as we can be?
That's amazing. A very good question. I think, you know, one of the things we could do as patients is make sure you get preconception counseling. Before you get pregnant, meet with your provider. Review your genetic history, review your family history. A mom who's had, for example, if your mother has had preeclampsia before, you have a high risk of having preeclampsia. If your sister had preeclampsia, you have a high risk of preeclampsia. So they're more likely genetic and environmental influences. Make sure that if you have any kind of chronic conditions, if you're overweight, if you have hypertension, if you have diabetes, all of those autoimmune disorders, make sure you suppress those as much as possible or improve those as much as possible. Those are things that we can do. And also, after pregnancy is a very good time. Once you deliver, if you have any of those conditions, any of those chronic conditions, or you develop preeclampsia, make sure, again, you're working with your healthcare providers, your primary care provider, your endocrinologist, your cardiologist, again, to improve those, because subsequent pregnancies, hopefully you can reduce some of those comorbidities. One other thing, Netta, is in pregnancy, women who have a higher risk of having preeclampsia, such as age, multiple gestations, pre-existing hypertension, history of preeclampsia, benefit from being on baby aspirin. So low-dose aspirin starting at 12 weeks to 16 weeks until about 36 weeks. I'm sure you're taking aspirin.
That's one of those that helps you lower your chances, even if you've had it before.
Yes, if you have a high risk for it.
Doctor, thank you for joining us this morning. I know I have so many questions to ask you.
Thank you so much.
Because obviously it's a personal thing I'm going through, but it's good to get your insight.
Thank you so much for having me.
And we'll